About 20 days
I'm
ago,
done.
a 97-mile-an-hour fastball foul tips off the bat and hits him right on the foot. Now,
Correct.
it says that he sustained a fracture to a bone on the bottom of the foot. I didn't see the reel of it or anything like that, but that's what I read.
Yes, it's
okay.
because when you're swinging, sometimes your foot kind of slides out, shows the bottom of the
Could
foot,
be-
and then bang.
Okay, so it'd probably be the inner side of the foot.
Correct,
Your
correct.
your foot has 26 bones. There's
Yeah.
a lot of bones, so there's a lot of bones that could be fractured there. So we don't know which one it is. But what we do know is you can get a fracture by a direct blow, a crush injury, or even by stress, like overtime stress fractures with running.
Mm-hmm.
When you get the crush or the direct blow, that's when you get, oh, look at Dr.
Yep.
Pierce, there's the foot. That's when you get more soft tissue injury.
Oh, yes. This is
So
last week's.
you have such a large amount of energy being exploded in such a small amount of time that you're going to get soft tissue, you're going to get tendon, you're going to get ligament, you're going to have a lot of swelling, a lot of edema to deal with. So that's the acuity of this injury as opposed to running and getting a stress fracture or something.
Correct.
So something like this.
So it's a bone
considering
contusion.
this,
Let's
with-
get down to it.
and everything else in between
It's a bone contusion,
contusion.
which is actually can be more painful. If we're really going to talk about the end, you're going to force me into this.
I
Do
am.
it.
And we
There
need
we
to talk.
go. Force
They
me
want to
into
know
this.
times. That's the thing. If you read the literature, everybody wants to know, oh, it's going to be longer timelines. So they're looking at timelines here.
But I mentioned this last week when we talked about it. You're talking about your foot. It's hard to come off. It's not a hand, right? You got to be on it. You got to be able to push off. You got to be able to rotate. You got to create torsion. There's rotation on that. You're talking about an injury, and we're showing the foot here now, but there's different bones, and I don't think there was any displaced fracture. There was a questionable
Just
fracture.
fracture, yeah.
But it's the bruising. A bone contusion is actually more painful because if you contuse the bone, it becomes a swelling into that area. So the bone doesn't have to fracture. It becomes actually more of an injury that can take longer. Bone contusions, sometimes you're better off with a fracture because you put the two pieces back together, you plate it, you heal it, and you move on. A bone contusion is like natural healing of the body.
And is it the pressure of this, I guess, bruising that's
Well, I'm
pushing
sure-
on the bone and the nerves that's causing that pain?
No, it's more ligaments. So the nerves are less involved in that part of the foot, but it's the tissues, it's the mechanics of it. Because there is a lot of bones, there's a lot of ligaments, and they all have to have perfect working order for you to feel well. You know, for him, I'm sure he's non-weight bearing. I'm
Yeah.
sure he's in a walking boot. I'm
Yeah.
sure he's getting treatment on a daily basis. But at the end of the day, would we put PRP and stem cell? So I've argued with a few orthopedic surgeons, why do it? A lot of podiatrists will do it. I don't know if he did it. It's going to increase your healing cascade. I love saying healing cascade because that's
good term.
really what stem cell and PRP is about. It's our natural healing cascade, and we move into that it can't hurt. I don't know if he's done it. It can help the ligaments. It's going to advance the treatment of healing, that healing cascade. There's certain steps, and they all have to happen. Like I always use the example, when you cut yourself, you bleed, and then you clot, and then you scab, and then you get this scarring and healing. That's all the body doing it. I 100% always believe the body is the best mechanical machine we've ever invented. How it can self-heal, how it can birth, how it can do everything. There's stuff going inside your body, the damage you're doing by drinking certain drinks, you don't know, but your body's healing all the damage we're doing. Our McDonald's, our cholesterol. Your body is working against that you can't see. It'll work for him also. To give a time frame, which everybody wants, first of all, I don't know his personality well enough. His position should allow him to return a little bit better. He's not one of the. He's
21.
He's younger.
He's
younger
20.
yeah.
21.
21.
Outfielder.
Outfielder.
He's
Yep.
got to
yeah.
run
Yep.
with a cleat.
Right. He's
and
got to run, but
different
he's
terrain.
not. No, those terrains out there are not rough. They're beautifully manicured. But it's going to be see how we do. And I think because he is 21, we want to make sure he's 21. He's healing way better than us back nine people.
So there's a couple things. His age is going for him.
Yes.
Number two is that he's got the whole medical team helping him and rehab team. So they're minimizing his swelling, and he's doing rehab now in other parts of his body that's going to help him along. And then the third thing is, thank God, there are some bones in the body that don't have good blood supply.
Yeah.
One in the wrist that I can think of, femoral head in the hip that I can think of, but there are no bones in the foot. All the bones have a good blood supply. So there shouldn't be any complications with that. So, and the other good thing is they have x-rays that they're going to be monitoring so they can tell you when the bone is healed, and then it's the rest of the soft tissues and everything else and the weight bearing and then going ahead and return to sport.